everyone. Welcome to IdaaHub Podcast, AI in Healthcare with Elizabeth Daley again. This is part two of our discussion, and we are going to talk about out of network and most important things for hospitals and patients to know about. This is really important for me too. As I mentioned to Elizabeth, that I would like to share a small thing, like where I felt this was extremely important. In the past, maybe 10 years, 15 years back, I had been to a hospital for small back pain, and we went through multiple doctors, multiple tests, and finally, I got a painkiller back home. And what surprised me with this was, I mean, we did not really know what it was, and I had to go to an emergency. But then by the time I came back in a couple of days, it still took me quite some time. And by the end of few days, I got a $2,500 bill. And like, what? I mean, it was just one small painkiller, right? I mean, I could have probably got it out in CVS there.
Mhm.
So back then, I really did not know how this worked, what's going on here. So I would like to start with some basics with, okay, with in network and out of network. When there's some kind of a health issue, nobody really first goes into checking all this. So could you tell us, like, what's the difference between them from a hospital perspective and from a patient perspective?
Yeah, for sure. No, so, just to keep it real simple, what's the difference between in-network and out-of-network claim processing? Honestly, there's a lot of confusion for everyone. Your example was very perfect because especially in those situations coming from the patient point of view, we're not necessarily going, okay, do they take my insurance? Are they in network? Are they out of network? Especially if you're in an emergency situation. It's not the first thing that's on your mind, right?
Correct.
So the way that I explain to people, either if they're in the healthcare world or not, you got to think of in network as like going to a restaurant where you already know what the menu prices are. The hospital and the insurance company shook hands ahead of time and they agreed on the rules, the pricing, who pays what. It's predictable for the most part. And it's
Right.
structured. And everyone knows what is coming, again, for the most part. However,
Mhm.
now looking at the out of network world, that's like walking
Mhm.
into a restaurant where there's no menu, no prices, and you get the bill at the end and go, wait, what? Just like you were mentioning. Like I went and had
I
this
know.
session and now I have this bill and it doesn't really explain. So there's no contract, the rates are not negotiated, and every claim becomes a negotiation. So it's time consuming, it's unpredictable, and honestly, hospitals end up doing a lot of the chasing.
Wow. So, I mean, how does this handshake happen? I mean, this is something each hospital has a different handshake, or is this something, what do you think there?
Yeah. Yeah. Every hospital, every organization, every provider has to go through a contract negotiation. So you have to file your applications to be credentialed, and then you go through a contracting process as well. And especially from the patient's point of view, there's a lot of things that go behind the scenes, a lot of negotiations, a lot of back and forth that it's hard to understand because it is complicated. It is hard. And I know a lot of hospital systems, a lot of providers are trying to do the best what's for the patient. But I think there's a misconception between, oh, well, the hospital just wants money, or, they're just trying to get all the money out of my pocket. Well, it's really between the provider and the payer and being
Right.
able to provide that service to the patient. And I've seen some hospitals where they've taken that cost, they've eaten that cost, and they continue to have more admin costs that come into it where they need to have an increase of reimbursement expenses. I mean, everything's more expensive now these days, right? So
Yes.
it's really hard, especially from a patient point of view. I mean, I've been in healthcare for 2 decades. And there's times where I go to the doctor's office and go, okay, what did I sign up for? What are my benefits? It's not, we all do open enrollment. We all go through the price process. So, from a patient perspective, and this is my favorite, is
Yeah.
well, I asked them if they took my insurance. Well, of course they take your insurance, but you need
Right.
to ask, are you contracted? Are you in network with my plan or are you out of network? So for patients, out of network care can feel like a financial plot twist. So suddenly you're dealing with higher deductibles, higher out of pocket costs, surprise bills that nobody
Right.
really warned you about. And EOBs just look like they're writing a different language. And the biggest challenge is patients often think, well, I have insurance, I should be covered, but what you're covered and where is what really matters.
Right. I mean, I know EOBs are explanation of benefits, but looking at one of them, they're like so complex. I don't even know how a patient can even understand them, right? It gets complex day by day.
Oh yeah. And they
Yeah,
purposely almost highlight the amount that the hospital or the provider has charged to the payer side, just really highlighting that big amount instead of really breaking down, okay, yes, this $1,000 bill was sent to this payer, but the allowed amount was this amount. This is how much was the patient responsibility. This is how much was paid. This was what's denied. But they purposely make a lot of those explanation of benefits really hard to read. And it's not like every single payer has a standardized form that goes back to the provider or to the patient. They're different for every single one. It's almost like when you go and check out with your credit card. It's like, do I tap it here? Do I tap it down here? Is it on this? Like it's just a little everywhere.
yeah. I mean, now, like you said, it's getting expensive day by day, right? I mean, healthcare premiums have gone up like in 10 years, I think. I cannot imagine. Maybe it's double, probably.
Oh,
Uh,
100%. Yeah.
yeah. So what does it mean for hospitals and patients now?
Yeah, great question. So for hospital, it means that revenue cycle becomes a little bit like playing whack-a-mole. More out-of-network claims mean more denials, more appeals, more back and forth with the payers, more costs to collect the dollars. And for the patient, it means the real financial vulnerability. People who pick high deductible plans to save on premiums often end up with a bill that they never expected and sometimes can't manage. It's just tough for both sides.
Right. I mean, the system itself is so complex. I cannot imagine how anybody can understand and navigate through this. And I know hospitals work through multiple payers, right? I mean, so they do this handshake with each payer different, is what I'm assuming. Isn't that right?
Yeah, that's correct. And it's funny, I just had a conversation. I guess it was 2 weeks ago, right before the holidays. And somebody put in a perspective. It was a very good analogy that from a provider point of view, you have to learn all of the different payers' playbooks. You have to understand what their rules and regulations are versus if I'm just the payer, then I only have to process according to my rules or my claims and how we process things. Whereas the hospital has to basically learn all of these different rules and regulations. So it comes with a
Right.
lot of strategy, and I say a lot of caffeine. Each payers that have different playbooks, different codes, different definitions, different documentations, demands. So the hospital is successful when it comes to stop treating denials like a single problem instead just building those really specific playbooks that are needed to analyze different dashboards, having special teams who speak the Blue Cross Blue Shields of the world or the United very fluently and being able to automate and handle those items on repeated stuff. So when you combine smart people, good data, and clear processes, you pull a denial rate of chaos into control.
Yeah, I think that's one of the big reasons where revenue cycle management companies come in, right?
Yeah.
This is too hard for hospital, even administrative staff to handle all this. So, what are the common reasons that these denials happen?
It's so funny that we're still talking about denials years and years later. And I continue to learn more and more every year about these. And we were just at a HFMA conference 6 months ago, and this was the top item for every single provider at that conference. So obviously the top usual suspects are still in you can say like the top 5 or 6
Okay.
authorizations that were not obtained or wasn't correct is usually one of the
Okay.
number one things. Patient eligibility issues, coding or documentation gaps,
Oh
timely
my God.
filing because the clock starts ticking fast, medical necessity is another one. Those disagreements of going back and forth. And again, I'm in the out of network world, so anything out of network. And the usual fix is not always glamorous, but it works. You've got to strengthen your front end. And those are the first people that interact with the patients. They are the people that are answering the phone calls. Once you standardize those standard workflow process, you can educate not only the clinical, but the clerical staff as well by using real-time analytics. It's like tightening bolts on a machine. It just keeps the whole thing running a little bit smoother.
Uh, So, even patient eligibility again, I mean, you
Yeah,
said denial, and they already know they're out of network, right? And then they again check the eligibility and they turn out they're not eligible. Is that
yeah,
what is?
yeah. I mean, I've been in situations where, from the provider's point of view, you've already called the insurance company. You may have a software that checks the eligibility in real time, and then a few months later, they come back that the patient's not covered. Maybe they ended up changing their Blue Cross Blue Shield card to another type of group. They're still with the same company,
Mhm.
but it may be the same, it may be a different policy, but that card they had last year, but they haven't replaced it with a new one. And or we've had situations where they're in the middle of changing over insurance or they didn't pay their premium. So at the time they were eligible, but the premium wasn't paid. And so that no longer covers that data service.
Oh my God.
Yeah.
This is like, it's really crazy to even think of all these things, right?
Yeah.
Yeah.
For
I
sure.
mean, I know another thing is like for a coding error, if it gets denied, it's sad from a patient perspective, right? I mean,
Yeah,
yeah.
for
So,
sure.
do you are you able to fix these denials? I mean, after everything is gone through, so how does it work? Because most of the time, a lot of it of us assume once we get a bill, I mean, I guess even the hospitals, right? That's it. I mean, I have to somehow pay this, right?
Mhm.
So how does this work? How do you manage these denials?
Yeah, I'll share like a success story because I always like success stories. There was a hospital system that I worked with that had really high denial rates. I
Hmm.
spoke 30%. Their staff was frustrated, the CFO was frustrated, and everyone felt like they were just drowning in the payroll. So what we did is we centralized their free authorizations. We
Okay.
built a denial root cause dashboard for them, train the team based on specific payer reports, and automated their eligibility checks and held weekly payer conversations. So within 6 months, those denials dropped at least 40%. Their appeals went down as well, and they were able to collect almost, I think it was 17 or $18 million a year more. So it's
Wow.
yeah, I mean, sometimes it's just is really looking at what you can control internally on your side because there's going to be denials on either side that either have been missed or it was an accident or maybe it was processed. But the best part is the staff went from a burnout situation to we've got this. They were like more excited. And that was just really priceless to have a team of people that were just defeated to get their passion back.
I can imagine that's a lot of money out there on the table, which
Oh, for
you,
sure.
I know you should not be missing.
I mean,
So,
I don't know about you, but I would, if that was my personal money, I would enjoy an extra 17 or $18 million in my pocket too.
right, right. I mean, even for patients, this is the same thing, right? I mean, this is from
Yeah.
a hospital point of view, but is that something patients themselves can try on their own?
I I always strongly encourage patients to review their EOBs, ask questions,
Mm.
call the hospital or whatever the provider and have them explain it to you. That's what they're there for. That's, we do that a lot. It's a lot of education. Okay, well,
Yeah.
this went your deductible, or this goes to your co-insurance, or maybe it was denied, or you know what? We actually, let's double check to make sure we have the correct insurance. Let's make sure that we have everything here, because there's some times where it may not have been processed correctly at the hospital or on the payer side. So it's always good to question it. I always say, unless it's, a $5 or $10 bill that you know that you should be getting, I would always double check, call, the hospital, call your payer, get involved. I've seen in some situations where when the patient gets involved, especially on the provider side, having them involved in some of these appeals and denials, getting them involved actually helps the claims get processed faster too.
Wow, that's really good to know. I mean, because I guess we should always go back and check what our
Yeah.
bills, and
Oh yeah.
there's no harm asking, right? I mean, always
Absolutely
ask.
not. Yeah,
Right. I know.
absolutely not. Yeah.
Right.
I mean,
I
like
know.
you said, no harm, no foul, and questioning, making sure that whatever you're paying out of pocket, I've been guilty on the provider side where we had a payment for 20 or $25 that was sitting in a holding pattern in the patient's account that was never applied. And they're like, hold on, I made that payment. So
I
after
know.
doing research and digging into it, it was our mistake on our end. So obviously we had to make that correct and find out why that was happening and correct that mistake very quickly.
Yeah, I can imagine that. I mean, when the patient gets involved, they really speed it up. So,
Absolutely. Yeah.
so is there one specific reason which happens more than others in terms of denial? What's been your experience of all
Now,
those?
yeah, I wouldn't say one way or the other. I think it depends on demographics. It depends on the area that you're from. It depends on maybe the specialty too, because there's
Mhm.
different denials, like with a cardiologist versus OBGYN. There's obviously different types of rules when it comes along in those lines. Being able to predict them before they happen is also very important. But yeah, there's not one solution to all. And it's just making sure that you have the right people in place, the right data in place, so you can, capture those opportunities before it's too late.
Okay. Okay. That makes sense. So I guess the more informed you are, the better it is
Oh,
there.
absolutely. Having the right team behind you, if it's internal, external, a little bit of both, a hybrid approach, and having a second look at things are always really good, positive things for the organization.
Right. So I know you mentioned your success story, which is really interesting with so many dollars which they could have missed. And so how does the process look like? Is it a lot of time on the phone, talking to different people, trying to figure out what happened kind of thing here?
Yeah. I think we really hear too that kind of goes into people are talking about AI, handling denials. Should I automate things, calls to pairs? What's realistic? What's, typical? So I would say there's obviously a little bit of both. AI is fantastic at the grunt work, predicting the denials, drafting appeals, extracting clinical information, and navigating the phone trees. But when it comes to negotiations and complex medical necessity arguments, understanding the payer policies written over in lawyer language, AI isn't usually, or what I've seen so far, isn't there just yet. It's a force multiplier, not a replacement. So think of like AI as a co pilot, not the actual pilot.
Okay. Yeah. So the AI they use for phone calls also nowadays, right? I know a lot of this would be calling the payer, finding out what this means, something that was missed when the denial happened. Can AI negotiate now, or are we there yet? Or we are, it's not something the AI can't really
Yeah,
negotiate with the human.
I haven't seen AI be able to replace that just yet. You still need the human or the experience and the knowledge to be able to understand all the complexities that go along with it.
Right. I I guess if you have humans on the other end, you really need to be have a human on this end as
Oh,
well, right?
absolutely. Yeah, when it comes to decision making, for sure.
Right. I mean, there's a ton that people are talking about where, oh, it's possible a payer AI can talk to a provider AI at one point, but I don't know how that's gonna look.
It'll be very interesting. I'm very excited about obviously new developments over the years. You know, everything continues to change. I'm surprised there's a lot of tech conferences out there that have a lot of information, and I'm all for it if it's improving the process and making people's jobs a little bit easier, because it seems like we've already been fighting the uphill battle of it being harder and longer hours. So why not take some of that load off of, the day-to-day grind?
I know. Yeah, I hope it frees up more of people's time so we don't spend on these things and
Yeah.
reduce more denials that way,
Yeah.
right?
For sure. Yeah. Every time we have someone involved in this type of admin process, it's the costs and cost of healthcare keeps on going up.
Yes, definitely. I hope it someday we see it coming down as well. That day
Yes.
hasn't come.
That would
Yeah.
be fantastic.
Yes. So what would be that one big advice you would give to hospitals, right? From to to reduce the denials or anything, a, a takeaway.
Yeah. So my top advice is ask questions before the service, not after the bill, if you can. Obviously, an emergency situation is a little bit different.
Okay.
Ask if the provider's in network. Don't assume.
Hmm.
Right? Request a written estimate. So
Okay.
under out of network, you are covered on what's called the No Surprise Act. But I
Mm.
always, when I go to a doctor's office, if I'm getting something that costs more than what I'm going there for, let's just say an MRI or CT or mammogram or whatever it may be, that might be my cost, ask, get an estimate, know what your deductible and out of pocket is, in network and out of network. That's just the basics of knowing your insurance. Also, ask about financial assistance or payment options. I had to go through this with my mother about 10 months ago when she went through cancer treatments, and asking about financial assistance was not the first thing on my mind until a little light bulb went off. And as soon as I asked, she qualified and the medicine was covered. So ask. Also, double check your explanation of benefits, those EOBs, and don't be afraid to appeal. You, as a patient, also have the option and the right to appeal. Patients should not often feel powerless in the system, but
Right.
knowledge is really the power. It's like the more you ask upfront, the fewer surprises you face later.
Right. Right. No, that's really good advice. And what do you think with out of network? Are you seeing more hospitals out of network than few years back, or they're going in network? What is your opinion?
I would say, especially there's been a shift over the last 3 or 4 years with this No Surprise Act. I definitely have seen over the last year or two where some of the larger hospital systems are going out of network with the larger payers. We've seen in the past where they were smaller, or maybe a surgery center wanted to be 100% out of network. But we're starting to see more hospitals take a different approach and strategy that goes along with out of network. It is complicated. You do have to have the right strategy in place. If you have the right partnerships and people in place, it is successful. It's just knowing how to navigate the complexity of it. So these multi-billion-dollar systems, I mean, it's scary because your
Yes.
marginal lines for hospitals are very, very low as it is. So you don't want to make the wrong move or the wrong mistake. You are obviously there to provide services to the community and to the patients. And so you're doing the best that you can with what hand you've been dealt with.
Yeah, absolutely. I mean, I also know that a lot of patients have gone higher deductible plan recently. I right? I mean, that would also increase out of network patients more at some point,
Yeah.
probably.
Yeah.
Yeah.
I mean, yeah, it just depends. Yeah, I'm definitely seeing higher deductibles over the years increase. I think that's just because, again, premiums are really high. You're I mean, I used to work for a company about 10 years ago that used to cover our premiums at 100%. That is very, very rare these days. So
Correct.
obviously, as the patient, you have, you know, you are paying out of pocket yourself or have a cost sharing that comes with your employer, and it's just hard to fork out, hundreds and hundreds of dollars, sometimes thousands a month if you have a family involved, and you still have a
Right.
deductible that has to be met before anything is covered.
Right.
Yeah, I just
Wow.
knowing what those benefits are, what covers, if you have options to be able to choose more than one plan, that's also great. A lot of people are looking at HSA accounts as well and,
Yes.
looking in those. But the good thing is a lot of the plans, this is what I always tell people to look into is what is covered outside of that deductible, because a lot of well women exams are covered. A lot of, your physicals will be covered and not applied to your deductible. So there are some benefits that don't hit the deductible. So always look at those plans, ask those questions during enrollment. You have to make a phone call and, to your payer to, see
Right.
what's covered and not.
Right. Right. No, that's very interesting. Recently, I've also seen when I went to a CVS, they've been telling me with insurance it's this much. Without insurance, the cost is going to be this much. Would you prefer this or that? Like, so I said, like, oh wow, I've never seen somebody talk about this like this before. Like every time I go to a CVS, so
Yeah,
things are changing, right?
absolutely.
Yeah. Okay. Thank you so much, Elizabeth. This has been a really engaging discussion.
No, thank you.
And
I appreciate it.
yeah, and I really feel patients and hospitals should listen to this. They will learn a lot of things, and especially your, from what I understand, your big tip for the patients is to always ask and look through their bills, right?
Absolutely.
Thank you. Thank you
You're
so
welcome.
much.
Thank you for having me.
Thank you, everyone, for watching the IdaaHub podcast.